Good evening, everyone. Good morning, good afternoon, and assalamu alaikum. We welcome you to our patient-centric care session today, and very excited to have everyone join us. Dr. Nitin and I will be your chair and co-chair for this session. On behalf of both of us, and I'll actually take the liberty to say this on behalf of our speakers as well today, that we are extremely excited to have the Neuro-Oncology medical community focus on dedicating time to a session on patient-centric care. The aim today in today's session is to basically provide, to sensitize clinicians and to also, sorry, I'm just going to share my screen. Can you all see my screen now?
Yes.
Perfect. So the aim in today's session is really to highlight the exceptional work and success stories celebrated by brain tumor patient organizations across the world, to sensitize clinicians and give an understanding to the neuro-oncology medical community, the areas where patient organizations could use your support, and to remind you to always keep the patient's perspective front and center. We have a joint mission to bring the best care to brain tumor patients and caregivers, and for this, we need to support each other. I'll actually start by asking you a question. Did you know that support groups coupled with medical treatment have been shown to be more effective than standard care alone in most settings? In fact, research shows that patients may find it possible to develop a more active, participatory, and proactive attitude towards the illness, and at the same time may feel supported during the process of recovery. Several research results have also demonstrated the efficacy of psychoeducational support intervention through an increase in functional coping strategies, an amelioration of the quality of life, and a reduction in pain and psychopathological symptoms, mainly depressive and anxiety-related symptoms. And also an enforcement of some biological parameters, such as the ones linked to defense mechanisms, and an improvement in the treatment compliance relationship with regard to family, increase in capacity in terms of cohabiting, facing the disease, and self-efficacy. And this is both in oncologic patients and in caregivers. In fact, more studies show that caregivers have actually benefited from caregiver support groups, and specifically with less depression and less sense of burden. And this is done due to a sense of commonality, a validation of the caregiver's experience, and opportunities to give and receive help. However, I'll pivot to my personal experience because all of this did not exist for myself and for my late husband, who was suffering from a GBM. I can speak from my experience as his caregiver, as Taha was first diagnosed in 2012 and then succumbed to a GBM in 2015. He was diagnosed in a span of a week, and he was diagnosed from being a healthy, active, ambitious 36-year-old to all of a sudden learning that he has one of the most aggressive forms of brain cancer there is. And then the flood of questions started coming to both our minds. First, the more practical questions came, which was, when will treatment go on till? How do we manage work? Should we get a second opinion, or maybe a third or a fourth? And then as treatment progressed and prognosis worsened, the more morbid questions came to mind. What does this diagnosis really mean? Will we ever be able to have kids? And then later, when we moved into his end-of-life care, I started asking questions like, what will life be like for a young widow? And I share this personal story more because this part of our journey was very, very isolated for us. And although the medical support was phenomenal with the doctors on the team, the non-medical support and trying to find people who could relate to us pretty much didn't exist. And with this in mind, we actually set up the Brain Tumor Foundation of Pakistan. It was launched exactly a year ago, and I'm actually excited to say it was launched in September 2020 at the first annual Neuro-Oncology Symposium. So exactly a year ago at this session last year, we shared that we'll be launching the Brain Tumor Foundation of Pakistan. Our mission is to reach every individual in Pakistan affected by a brain tumor. We've launched in partnership with the Pakistan Society of Neuro-Oncology. And we've actually started reaching out online and through various platforms to patients to help raise awareness and provide access to information. With Dr. Essen here, we run monthly support groups with patients. They're small right now, but they are growing. And even though we're a nascent organization providing this support in Pakistan, in a short span of a year, we already have more than 1,500 members in our online community, be they survivors, be they caregivers, or patient advocates. We'd like to make sure we continue to grow and, of course, partner with organizations, patient organizations globally to learn from each of them. And you'll see as we showcase that going forward in this session. But we'd also like to partner and associate with the neuro-oncology medical community in Pakistan. And we invite you to help us reach out to more patients. And similarly, I'll also share that Dr. Nitin set up the Brain Tumor Support Group Awareness Foundation in India with a similar mission of reaching out to brain tumor patients and caregivers in India. And I work quite closely with them as well, especially since when we started our support groups, we wanted to understand how to run them, and Dr. Nitin's team has been super supportive in that front. And Dr. Nitin, I don't know if you want to share a few words about your foundation in India.
Yes, so Komal, our experience has been same. It's been now 2 years, and we are also slowly growing. And I think, as you are aware, we are part of the Asia Pacific Brain Tumor Association Alliance, and with Kathy being in IBTA, I think helping each other out is the only way forward, because it's tough to start with, but as you will see, and as has been our experience, it is really very helpful. I am a clinician, I'm a neurosurgeon, and I see both sides of it, and I can tell you that it really helps the patient and their caregivers. So it's congratulations to you. Starting is the most difficult thing, but once you have initiated, you have gone through first year, I think it's just matter of time when you will soon spread. So all the best. And it's also very excellent thought process of the PASNO to have such a symposium, because this is how the clinicians are exposed to what actually we as support groups can provide to our patients and to the caregivers.
Great, thank you, Dr. Nitin. I'll move on to share that we have a host of international and national speakers who will be speaking today and showcase the wealth of work that is being done by patient organizations across the world, and also to let you understand how it feels like to be in the shoes of a patient and a caregiver. Our agenda consists of a speaker series, and at the end we will have a panel discussion which is focused on quality of life and working together to improve the lives of everyone impacted by a brain tumor. We will take in questions, so please share your questions during the session with our moderators.